This center is really an achievement that we're very proud of. It's something that we worked very hard to write the grant. It was a very difficult grant. I think Dan and Mary Ann and everyone else who was involved will concur. It's probably one of the most difficult grants we've written. And the process of actually getting the grant was rather long. What happened was that they had 7 or 8 regions in the whole state that were supposed to apply, and all the providers like Oasis had the opportunity to apply for the grant. And it ended up with not as many applying as they had hoped. And it was touch and go for a while whether they were going to even implement this program that they wanted to do. But the commissioner is adamant that this whole science-based theory that we're seeing working well here in Orleans County has to be spread around the entire state. Every community is not as fortunate as Orleans County having a coalition and also a DFC coalition, which means funding, which we've all talked about. It takes the effort of a community to make this all work. So what we're going to do in the 8-county region of Western New York, which includes obviously here and from Niagara County all the way down to the state line, Chautauqua County, over and back up again, we're going to work with community coalitions, and we're going to use the resources available from providers like us, and also people who are on coalitions, and also from the state level, from Oasis, the money, the dollars that they're giving us for this grant. It's a lot of money. It's not enough money. It's $250,000. Seems like a lot of money. We all would say, yeah, that should be enough, but in most cases it's not. But we're going to work with that, and right now we're in the process of getting organized. We're going to be going out and meeting with the people we talked to when we wrote the grant, and we will get them identify what coalitions are out there. My understanding right now is there are approximately 100 coalitions in New York State. We feel there's probably about, I'd say probably, I know in our region, I can't speak for other regions, but where there are 5 DFC coalitions, and we're 4, now they're 5, because you're the 5th one. And our ultimate goal is to help these coalitions that are new, or they're intermediate, or even if they're advanced and do not have funding, to help them get funding. That'll be one of our objectives also. But I want to share something with you. I think this is so relevant for this meeting today. There's a research study that was done on part because it's required by the CSAP, which is head of the whole DFC coalition. Excuse me. Let me just quote something. This is a finding that was just recently released. Findings from evaluation of the drug-free communities program showed that in communities where there are DFC coalitions, substance use rates among high school students were significantly lower than national use. The data were released by the Office of National Drug Control Policy this week, and that was dated 9/25. And a little bit further, the analysis shows that between 2006 and 2007, current use rates for communities with DFC coalitions declined for all 3 substances measured, alcohol, tobacco, and marijuana, in grades 9 through 12. In addition, in both 2005 and 2007, communities where there are DFC coalitions report significantly less past 30-day alcohol, tobacco, and marijuana use than communities without a DFC coalition. I think this is incentive for all of us to do the best that we can to keep going now that we have the funding and bring the rates down even more. Thank you.